Thanks for coming today. We are here to talk about your diagnosis and your treatment options for uterine fibroids. Please be reassured that fibroids like yours affect about 2 in 3 women in the UK, and there are a number of effective treatments available.
Could you tell me a little bit more about fibroids? Are they a sign of something more serious?
In general, fibroids are benign growths that develop in or around the uterus. Benign refers to a condition, tumour, or growth that is not cancerous. Fibroids do not spread to other parts of the body. Fibroids can vary in size, and while they are not cancerous, they can cause discomfort and a number of unpleasant symptoms. If left untreated, such symptoms may worsen over time. There are a number of different treatment options, but based on the size and type of your fibroids and your medical history, I would recommend transcervical fibroid ablation, a treatment called Sonata.
Will I need surgery to have the fibroids removed? Is Sonata a surgical procedure?
Yes, Sonata is a surgical procedure. The fibroids will be treated but not removed. The Sonata treatment is a minimally invasive, incisionless procedure. It uses ultrasound and radiofrequency energy to target and treat fibroids from within the uterus. The procedure is typically performed under local anesthesia and in an outpatient clinic. Some patients might prefer to have the treatment under general anesthetic in the operating theatre, and the choice is yours.
What are the advantages of Sonata?
Sonata offers several advantages. Firstly, as I mentioned earlier, Sonata is incisionless, there's no significant pain, and it's an outpatient procedure.
Okay, does that mean that I don't need to stay overnight after the procedure?
Correct. Sonata is an outpatient or day surgery procedure. Generally, patients are scheduled to go home the same day and return to normal activities within a few days. Additionally, most patients experience significant symptom relief, with studies showing an average fibroid reduction of up to 67% within 12 months. And unlike a hysterectomy, Sonata preserves the uterus.
Okay. Would you please explain a little bit about how the Sonata treatment actually works?
The Sonata treatment uses an ultrasound tip, which allows us to see the fibroids inside your uterus during the procedure. The Sonata handpiece is inserted into the uterus through the vagina and cervix, and using the ultrasound tip, is able to locate the fibroids, and we can see them on the screen. We then use radiofrequency energy to treat some or all of the fibroids. The result is that your symptoms should diminish.
And is it painful?
If you opt to have the Sonata procedure under local anesthetic, you will be asked to take some pain relief before arrival. Upon arrival and prior to the treatment, your cervix will then be numbed to ensure you experience minimal discomfort. Some patients might experience cramping, similar to menstrual cramps, during and after the procedure. This can usually be managed with over-the-counter pain relief.
How long will it take for my symptoms to improve?
Most patients start to see improvement with their bleeding within 3 months following their Sonata treatment.
How long before I can return to work or exercise?
Every patient is different, but research shows that many women return to normal activities within days.
Are the results permanent? Will the fibroids grow back?
Only hysterectomy is a definitive cure for fibroids. Sonata, as with other alternatives to hysterectomy, cannot guarantee that your fibroids will not grow back. However, clinical trials have demonstrated a low risk of reoccurrence.
Is the Sonata treatment safe?
Sonata has a great safety record, with over 15,000 procedures performed. Remember, fibroids are very common and treatable. The Sonata treatment is an innovative, effective solution that can help improve your quality of life as your symptoms recede.
Are there any potential side effects or risks associated with having this type of treatment?
Common side effects include bleeding, spotting, cramping, and/or discharge. There are potential risks such as skin burn and infection. Women who are pregnant, have a pelvic infection, are known to have gynecologic cancer, or have intratubal implants for sterilization should not have this procedure.
Where can I get more information?
from sonatatreatment.uk, where you can refer to our FAQs and patient leaflets. You may also find it useful to listen to other patients on our website who have had the Sonata treatment. You can, of course, contact your consultant with any further questions you may have.
Thank you.
Common side effects may include bleeding, spotting, cramping, or discharge. There are potential risks with this treatment, such as skin burn and infection. Patients who are pregnant, have a pelvic infection, are known to have gynecologic cancer, or have intratubal implants for sterilization should not have this procedure. For full indication and safety information, visit sonatatreatment.uk/safety information.